Hello, I'm Maria Hall-Brown. Welcome to Protest+Promise, a wonderful opportunity for young Angelenos to get an idea of what's happening in their community and share information with those that are making things happen. I'm delighted today to be joined by Heidi Marston. She's the Executive Director of LAHSA, which actually stands for Los Angeles Homeless Service Authority. It's a complicated subject. We've got a lot to unravel, so let's get going. First, I'd like to say hello to our panelists. Hi, Brianna.
Hello.
Hi, Dorian. How are you? And Evan, so lovely to see you.
Hi.
Now, last time we talked, the issue of homelessness sort of bubbled to the surface in terms of how you all feel and how important it is and how you're recognizing the problems in your world around you. And that's one of the reasons we're so delighted that Heidi is here. But I think what we really need to do is sort of get some base understanding of what it is that Heidi does. So what exactly is LAHSA and what does it do?
Yeah, absolutely. So LAHSA is what's called a Joint Powers Authority. So we are an entity that is funded and overseen by the City of LA and the County of LA. And the idea is that we're the entity that can really bring a comprehensive response to homelessness. The City of LA can't do it by themselves. The county can't do it by themselves. We can't do it without the state or the federal government either. So LAHSA is really the center of all of that. We provide money to our nonprofit partners who are really on the front lines doing the work and really making sure that all of our partners at all levels of government are coming together and that we're all kind of rowing in the same direction in terms of our response.
Is it true that 1/4 of the homeless population in the United States actually is in California?
That is correct.
That just seems to be an overwhelming hurdle.
Overwhelming hurdle, and even more so here in LA County. So the last time we did a homeless count was in 2020, a full count, and there were 66,000 people who were unhoused in LA County, and about 40,000 of those were in the city of LA. It's tremendous. It's just what we see in the city is what some states, it's more than what some states have as their total population.
Well, which actually brings me to, Evan, I know that you were thinking about what was happening with the homeless population during COVID.
Mm-hmm.
Yeah, I'm really interested to know how homeless teens and homeless people in general are being affected by COVID. I think it's great that we have numbers from 2020. Do you think that's changed between then and now? And how did it change between 2020 and pre-pandemic?
Yeah, great questions. So when the pandemic hit, it was a really interesting moment for homeless services across the country because what was quickly seen is that even though we're really good at responding to national disasters as a country, we have plans for that. Oftentimes the population of unhoused and specifically here in LA and their really specialized needs are overlooked. And so the first thing we thought about is, wow, we're all being told to shelter in place, but how do you shelter in place when you don't have a home? How do you shelter in place and stay safe and isolate when you have nowhere to go? So that was really our first approach is how do we pull in Department of Public Health and the federal government to create options for people to get inside, particularly those who are vulnerable. And so we opened up thousands of hotel and motel rooms through Project Room Key across the county. And as of today, over 10,000 people have gone through those hotels and motels. And so what it really showed us, I think, is that when we all work together, the city, the county, our nonprofit partners, the federal government, we all set our eyes on the same target. We moved faster than we ever thought we could, and literally thousands of lives were saved.
Is that why we see more literal tents versus, I mean, I'm older than all of you combined, plus more. Is that why we actually see more actual physical tents and things like that? I mean, actual structures versus people with cardboard, the kind of way we used to visualize what an unhoused person looked like?
I think it's a part of the reason. So one thing that happened during COVID was generally there's cleaning that's happening of encampments. So just like everybody else, you know, people who are unhoused accumulate trash and garbage and they need ways to get rid of it. So making sure they have ways to dispose of their trash and get rid of things they don't want anymore is important. Because of COVID, all that stopped. So what we saw was an encampment that might have one tent in it grew Doesn't necessarily mean there were more people. It just means there was more stuff that was accumulating because we weren't providing those cleanup services. So it's hard to know what the footprint's going to look like. And back to your question, Evan, around like what does it look like now? We just did our homeless count for 2022, so we're waiting for those results. But I think what we're going to see for sure is that there are more people who are sheltered who are homeless than last time. Generally, we've seen that if there are 44,000 people who are unhoused, the vast majority, like 70%, were not sheltered. I think we're going to see more people sheltered because we have so many hotels and options online, which is good. Really interested to see what the unhoused and the unsheltered count shows in particular, because to your point, we've seen encampments grow, but we're not sure that that means that there's more people.
Interesting. I'm going to go back to Evan again, because I know one of the things that you addressed was the idea of teenagers.
Yeah, I know we have a lot of people, adolescents, teenagers, and people that are, young adults. A lot of people come to Los Angeles at that age and end up unhoused. And we have a lot of people that, just aren't able to live with their parents anymore, get kicked out, end up on the street. How are they being affected?
Yeah. I think they're being affected in a real way. So part of how our system is designed is that we have nonprofit providers that specify in that population. So we really tailor services based on population. So you have your single adults who are kind of out there on your own. You have your families, which are households that might have minors or adult children. And then you have youth. So what you would use to help somebody who is 65 years old is different than what you would use and what a youth needs who is unhoused. And so we really leaned on our providers who specialize in caring for youth who are unhoused, because to your point, Evan, the circumstances are so different. There's often reasons why they can't stay with their family. They're aging out of the foster care system. There's a lot that has happened in their life, and so they need a very different type of intervention. And our providers did a fantastic job in really finding those folks and trying to wrap services and care around them the best they could.
Is that one of the statistics that comes out of the homeless count, is the age and the demographic and the location? I mean, what is the information? Obviously, the homeless count helps in terms of funding and need. But what is the information that you garner? You get to see what age bracket is going up or down, what area is going up and down, that sort of thing?
Yeah, it's way more information than I think even anyone realizes. Everything from the age to what part of the city they're in, race, ethnicity, where they came from, how they fell into homelessness based on what people tell us. Are they living in RVs? Are they living in tents or shelters? Are they experiencing mental health crises or substance use issues that we need to tailor? So all of that information is used and captured in the homeless count, and we take it and we use that to design our programs, and we say, wow, we've seen a change or a shift in this part of the population. How do we make sure we correct for that in our programs this year so that that's not getting worse going into next year?
Well, obviously, COVID was an issue, but I know Dorian had a very enlightened thought, because, the problem is not necessarily solvable if we don't make dramatic changes, but then we are making dramatic changes that are exacerbating the problem. So I know, Dorian, you had an interesting question in that realm.
So in regards, I don't like to say the word homeless, I prefer to say transient. In regards to transient people in the Los Angeles area, with gentrification going on, and then you had COVID that hit, where are we looking for relocation for these people and how they can, get the proper care they need when you have funding coming in for new construction and such, and you're having an increase of value in land. So with that, you're also now kicking away folks who are using that land for shelter.
Yeah, that is such a good question with so many layers to it. And first, to your point, I think language is so important, and you're right. People are not homeless, just like I'm not housed. People experience homelessness. It's not who they are. It's not a characteristic. And so I think talking about folks in that way, this is a circumstance they're going through, but it doesn't define who they are. So it's really important in our language to notice that. To your point around space and land, especially in LA, there's no space, and what the space we do have is often getting taken for luxury units and expensive new housing. I think all of that is true. So there's a couple things we do. One, we have relocation in terms of, like, if you're here in LA but your family is back somewhere else in the US, and you have a network and a safety net there, we can help you get back there. That's not really the case for a lot of people, because what we see is people who are unhoused are in the communities they grew up in. They've been in LA for 15, 20 years. They became unhoused in their neighborhood and they're still there. So you understand why they want to stay there. So the balance we have to strike is, recognizing that there's going to be these developments. How do we set aside enough housing that people can afford? So we work very closely with the city and the federal government to right-size that, but we don't have enough. We don't have enough housing that is affordable for people. And even if you're making minimum wage right now, you can't afford a one-bedroom apartment in LA. So that tells us that something is wrong in how we're building this. So we try to find existing units that we can take. We also look at hotels and motels and try to convert those and turn those into permanent housing just for people who are unhoused, who need a place to go. So we're getting creative, but you're hitting the nail on the head with the ultimate challenge, and it's the supply of housing.
You guys don't mind if I ask her a history question, do you? Because I know that there's sort of a historical background as to how LA almost primed itself for this crisis.
Oh, absolutely. So I think it's really important to remember that the crisis we see today is not because of decisions we made 5 years ago or yesterday. It's because of policy choices that were made 10, 15, 20 years ago that we're now manifesting. And so part of that is also really important to recognize, because the choices we're making today around how we address this crisis are going to show up in 10 years and 20 years because the crisis is that big. So this is a very designed crisis, and the housing market is operating the way that it was designed to operate. I always like to say that systems are designed to operate, so if you don't like the outcome of the system, you have to change the system. It's pretty simple, but this is how we design the housing market. We are taking away the federal housing that was really a staple for years and years. And in the 80s, that really was a disinvestment. The state used to provide billions of dollars every year for affordable housing across California, stopped making those investments. And so those choices 10, 15, 20 years ago are showing up today with a severe lack of affordable housing.
That and mental health issues.
Mental health crises, the redlining, the way that our cities were designed from the very beginning to keep out neighborhoods of color and to segregate neighborhoods. We see how it shows up today in the homeless count. We see how it impacts transit. All of these pieces, there's a really fascinating piece, editorial in the LA Times that I can share with you, but it talks about how redlining actually is manifesting itself today because of all of these pockets and how they were created. And so we really have to intentionally undesign those things if we want to create solutions at scale.
Are you all familiar with what redlining is? Okay, yeah. Oh, Brianna, a little bit of an
So redlining, yeah, no, that's okay. Redlining goes way back to zoning, right? So when in the early days when areas were being zoned, redlining would say, here are specific pockets of neighborhoods where we're only going to give loans to a certain level. So what it did is it intentionally targeted communities of color and low-income communities for predatory loans and for investments that was going to take advantage of them. And so you see today, you have areas of LA that are predominantly white and affluent, and then you have areas of LA that are predominantly people of color and have lower average household income. That's because the way that redlining happened, it pushed all of those neighborhoods and those low-income households into one pocket so that there could be the affluent area and there could be the low-income area. And it's something there's actually maps that you can look up and see exactly where that happened.
Brianna, what do you feel and think about when you pass a homeless community, on your commute or when you're out and about? What does it bubble up inside of you?
So most times I just am very curious on how they ended up there. A lot of times we don't realize how fast someone can become homeless and how easy it can be. And, if you're a student or something and you're living paycheck to paycheck, if you miss a paycheck or you lose your job or something happens and you don't have any kind of support network or somewhere to stay, you're home, you fall into that very easily. And a lot of people don't tend to remember that. And so they kind of have that negative view on homelessness and people who experience homelessness. And so that's usually what goes through my mind. Another thought is there any kind of outreach that's kind of going, like, there's all these kind of services to help these people who are unhoused and experiencing all these hardships, but is there any outreach being done to get this information to them?
Yeah, absolutely. And I think your point's right, because you can't miss the human factor in all of this. And to your point, every person who is unhoused has a story, has a specific reason and a circumstance. It could be that they got sick and lost their job and they can't pay their medical bills. I've literally seen people who get terminally ill and their medical bills are too expensive and they lose everything. I've seen teachers who are living out of their car because they just don't make enough for rent. I mean, the circumstances are important to understand, and I think the empathy that you're bringing, and even just having that conversation with people to understand how did you get here, is really, really important, so we don't make them other or, pass judgment on people because they are humans with stories and experiencing trauma actively. So there's that piece. But in terms of the outreach side, we have a very large county. We would be the 9th largest state if we were a state. And so what we do is we create pockets of services, because we know that how you respond to homelessness in Lancaster is going to look different than how you need to respond to it in the Valley or downtown LA. So we rely heavily on our nonprofits who have outreach workers who are going out every day and engaging with people in encampments and saying, not just saying, let's get you inside, but like, what's your plan? Like, what do you want to do? Because sometimes people don't want to go right into shelter. Sometimes they want to get an ID first. Sometimes they want a medical appointment first. So it's really getting to know those folks. And then we create what we call access centers across the entire community so that people have walk-in centers they can go to get connected to services. All of that to say we don't have enough of it, and the scale is much bigger than what we have resources for, but we really work hard to have what we call a no wrong door approach, that anywhere you show up, we can at least get you connected to the system and try to help you along your path.
Well, you bring up a really interesting point, and that's something that I keep trying to manage in my own mind, is that everybody has a story, everybody has an individual need, and there are those that want to be helped or want to help themselves. There are those that just don't understand what resources are available, to Brianna's point, how do you get the information out? Then there are those that just literally cannot take care of themselves for whatever reason, whether it be, mental illness, whether it be substance abuse, and yet they don't seem to fit into the shelter concept in which you have to behave by, follow rules or, so how is that going to get managed? Because those are the ones that seem to be the most random, because their behavior is not necessarily expected. And, they're the ones that'll run out in the middle of the street or have the most dramatic problems that require public service. So, how are we trying to do that individual care at the same time doing and embracing care? I don't know if my...
Yeah, I think I get what you're saying. Yeah, I think the first point to remember is that we have a severe mental health crisis in this country. Nowhere in this country can you go essentially and get same-day care for mental health unless it's a psychiatric emergency and you're walking into the ER. And if you can get care, it's usually expensive, it's exclusionary and hard to access. So across the board, we already have a big issue. In California, we used to have public mental health hospitals and those systems that would house a lot of these folks who are very severely mentally ill. Keeping in mind, it's like less than 10% of the population who's there, but that is who we see, right? Because they're experiencing severe mental health crises outside actively. So when the state closed those hospitals down, the idea was, let's close them and open clinics in the communities so that these people don't have to travel to a hospital, that they can get care right where they are, which is great in concept, except those clinics never happened. So what that means now is that we have thousands of people who are experiencing mental health crises and severe mental illness who need support, who don't have the resources to go to. So what we do in our system is we have general outreach services who are often people who have lived experience of homelessness or are from the communities that they're in, who are connecting people to housing or shelter, where you have folks who need higher level of needs, so either healthcare needs or mental health needs. We partner with the county to bring in mental health professionals, but again, just don't have enough of those. So that is something we're constantly advocating for to the state and the federal government. We need real funding and investment into mental health. So that we have those caseworkers and those professionals who can go out and engage with folks. And we need places for them to go because we also have a lack of that. So it's finding the balance between both.
What part of all of this have you guys not heard? I'm curious, when you talk about getting the information out to the homeless, what part of all of this, because you're all very in tune to what's happening in your world, that's one of the reasons you're here talking with us today. What of this haven't you heard? Evan, what haven't you heard, or have you heard this and, just still want to hear what's going on?
Well, I really want to hear more about what LAHSA and homelessness services in general are doing in policy specifically, and how we can support those efforts. Because of course, we see some of the work that you're doing on the ground in public, and we hear about those services, but how can we support getting the resources to do those services?
Mm-hmm. Yeah, that's a great question. Advocacy is such a huge piece of it. So both LAHSA at our website, LAHSA.org, as well as the United Way, we have policy agendas that we put forward that are tracking legislation at the state level, at the federal level, legislation we need, legislation we oppose because it would be harmful. So the more people that are paying attention to that and just being aware of the issues and reaching out to their elected officials to support or oppose certain things, that is really helpful because we need the public in this with us. And to your point, I think everybody has a role to play in addressing this crisis, whether you work at LAHSA, whether you're at a nonprofit, or whether you're just in the general public. And I think this is a really critical piece. We need elected officials hearing from people that these are the services that folks need.
Dorian, what haven't you heard? What would you want to, obviously ask Heidi, but also what haven't you heard?
Well, I'm more of a solution-based kind of person, of course. So I'm wondering, how can we not push, but propel folks who need homes to have access to these resources? Because, you can help someone, but like, as my grandma always say, you can't make a horse drink water. Mm-hmm. So how do we, mm-hmm. kind of push that narrative onto transient folks so that they can decide, or they're more influenced to make this decision to want to gain help, mm-hmm. mentally, financially, and personally.
Yeah. So just like, falling into homelessness generally doesn't happen overnight, but there's a lot of things that go wrong, whether it's deep issues like systemic racism that is like feeding into things today, or you lose your job or a health crisis. I think it's important to recognize that everyone who is unhoused is actively experiencing trauma, and everyone who is unhoused has been failed so many times. And so the lack of trust is real and understood. Why would you trust people to come and help you when you landed where you are? So a lot of the work is about building that relationship, but then also letting these folks be the pilot of their own life and the driver of their own life, and not saying, well, I want you to go here, and so you have to do that. Saying, what are the things you need so we can get you there? I think the other piece that's important to remember is we have so many people who want to be housed. I mean, everybody who's unhoused wants to be inside. We make it so hard to go in. We make it so difficult because you have to have an ID, you have to have a social security card. How do you get that when you're unhoused? And how do you find all of access to all these resources? So the process itself is riddled with red tape that at LAHSA, we're trying to really unpack that and kind of blow up all of those areas this just doesn't make sense because it's so difficult to get housing. So to give you an example, we have housing vouchers that we provide. So these are vouchers that people can take to a landlord and they will pay their rent. So the landlord, they sign the lease and their rent gets paid. We have thousands of people right now who are unhoused who have a voucher in their hand and cannot find an apartment to move into. Because to your original point, there aren't apartments or landlords aren't renting to them. So that is a part of this narrative that we really have to expose. It's not about people not wanting housing, it's that our system has made it really difficult.
So what kind of control can you possibly have on any of these landlords? Because, it's great to have this piece of paper that has value, but at that point, it's just a piece of paper.
Yeah, well, it's a guaranteed rent. You know, it's backed by the federal government.
But if I'm standing there and I can't use it, it's still just a piece of
Oh, for them? Yeah, absolutely. Yep. So we are always finding ways to motivate landlords to work with this population. So we have incentives for landlords. You know, if they sign it, it's for landlords, it's great because you get a guaranteed rent. They're never going to default on anything, you know, because it's backed. It's backed by all this funding. We provide case management in folks' homes. We do everything that we can do, but, you know, discrimination is real and people have ideas and that's real. And also, you know, what our vouchers pay is what's called fair market rate. And most landlords are charging way above that because in LA, you can charge more than that. So why would I accept $1,200 for this unit when I could get $1,800 for this unit? So that's a constant battle that we're trying to fight. And part of it means bringing this housing online through public sources and the government supporting big buildings of housing so that we're not battling with the free market to get those rents raised.
All right, Brianna, what have you not heard that you would like to hear?
Well, what comes to mind is kind of how I can help. So when I think about, like, say I have a friend that, and like they're couch surfing or something, and, you know, would that be considered homelessness? And, you know, there's only so much we can do to help them, you know, emotionally and financially. You know, we do want to help our friends, but, you know, again, there's only so much we can do. Everybody's got things going on. What are some ways that I can help them, or some resources that I can provide?
Yeah, great question. I mean, so when we look at federal definitions, things like couch surfing aren't even counted. So think about like 60,000 people, and that doesn't even count people who are living in couches. So that is really what we call like housing insecurity or unstable housing or shelter.
Just a hair's breadth away.
Just one argument, you know, one missed payment away, whatever it is. So I think the best thing that they can do is connect to nonprofits in their area. So if you go to LAHSA.org, we have a list of all of the nonprofits that provide services to folks who are either housing insecure or unhoused, and they have resources they can get connected to. But getting involved sooner rather than later is the key. Because what we find is it's always better to prevent somebody from falling in, like no matter the cost, than it is for them to become homeless and have to support them in their journey through. So at all costs, we want to keep them where they are and hopefully lift them back up, and our system can help do that.
The rules don't seem to work as often as they should. I mean, you're talking about red tape, but I also see a lot of rules about who can access what services when you're talking about a driver's license or a social security card, or even, you know, giving up your dog, not being with your family, whether they be legally yours or not, getting rid of all your drugs and alcohol, etc. The rules seem to prohibit as much as they are put in place to help. So is there a path at this point to sort of rewrite the rules, break the rules, reorganize the rules?
Absolutely. So here in LA, and in a lot of parts of the country, we follow what's called a housing first model, which means that we're not going to create any prerequisites for you to get into housing. So what it used to mean is that if you want housing, you need to be sober for X number of days, you need to have a job, you essentially need to prove that you are worthy of going into housing. Housing first takes all that away and says, we're going to help you get wherever you want to go. It could be treatment, it could be housing, it could be Montana. Like whatever that is, again, you are the captain, you're the pilot of your own life, and so let's help get you there. So that is one way to do it in creating that agency, but the rules are so entwined in the system and at every single level from here to the White House that we have to intentionally pay attention to it, and then we have to figure out how we either work around it, how we get waivers. What we do here a lot is we bring in local money to say, if this is the federal rule, let's bring in local money with our own rules that brings more flexibility. But it is complex, the issue is complex, and we all have to constantly be fighting, pushing, and paying attention to where if something doesn't make sense, question it, because usually it can be undone.
A note of optimism for our young people?
Yeah, well, I'm excited. I'm excited about the future generations. I feel like we're all going to be following you soon, and I think everything you've touched on is so right. Keep asking questions, keep listening to people and hearing their stories, and then keep centering them in the process so that we don't lose them while we're out in our bureaucracy land, like trying to create all the solutions. Just put them at the table, and they'll tell you what they need.
All right, and that is a wrap on another episode of Protest and Promise.